Good afternoon, everybody. My name is Melissa Cameron, and I am the Community Engagement Director here at Acclaim Health. And I'm so happy you're here with us this afternoon to help us celebrate exactly how much heart goes into extraordinary community care. So please keep yourself muted. There will be a question and answer period at the end. You can add your question to the chat and we will get to your questions then. And for now, I will introduce Angela Brewer, our amazing CEO here at Acclaim Health.
Hi, everyone. It's great to be here today. I'm going to begin with a land acknowledgement. Bonjour, as we meet today on National Indigenous Peoples Day within the treaty lands and territory of the Mississaugas of the Credit First Nation, and on the traditional territory of the Haudenosaunee and the Huron-Wendat peoples. Acclaim Health recognizes the hard truth that Indigenous people have experienced centuries of racism and genocide at the hands of colonizers. These ongoing injustices have caused immense pain to Indigenous people, the land, water, air, and all living things alike. Healing this pain is work we must all do. As part of this healing, Acclaim Health commits to continually increasing our knowledge of Indigenous perspectives and experiences and providing care free of racism so that all may enjoy the safety and security of good health. Finally, Acclaim Health extends our respect and gratitude to Indigenous people for their care of this place, which we all now call home. I myself live within the traditional territory of the Mississaugas of the Credit First Nation on head of the Lake Treaty Lands. And I think a great way to kick off our AGM is just a huge thank you to our staff. Sorry, I just lost everything I was looking at, just 1 minute. Okay, now I'm ready. Our staff really are the heart of extraordinary care. Our theme today is heart, and they really are the heart. And I really can't imagine a better team than the one we have here at Acclaim Health. And by team, I mean everyone who works here. The phrase above and beyond doesn't even begin to cover all the extraordinary efforts that every person at Acclaim Health has put in to ensure that our clients were able to receive care over the last year as the pandemic hit us with wave after wave. In the second year of the pandemic and already exhausted, short-staffed, and at times without the proper supplies, Acclaim Health teams rose above everything COVID could throw at them and proved without a doubt that heart trumps everything else. And their hearts are with our clients and our patients. I have to say, I've been truly inspired again and again by our staff, by the bravery, the dedication, caring, and above all, by their heart. I think if it weren't for heart, people would have given up a long time ago. This has been really tough work. And they really are indeed the heart of extraordinary care. I am deeply honored and privileged to work with every single one of our team members. And so from me to all of our staff, I give you a truly heartfelt thank you. I see Melissa waving her pom-pom there. And now I have the privilege of introducing one of our extraordinary staff members who's going to share her story of how clients live in our hearts long after they've left our care. Nicole's story of Gloria, one of her clients, is an amazing example of how our staff team and volunteers go above and beyond to wrap care around our clients. It's an example of how the support of our Client Assistance Fund and donated items can provide dignity and address all the urgent, unique needs that pop up in the lives of the people we help. I'm pleased to introduce Nicole Truman, one of our friendly visiting care managers.
Good afternoon, everyone, and thank you, Angela, for the introduction. So as mentioned, I'm the friendly visiting care manager there, and I'm sharing Gloria's story today to kind of highlight and bring awareness to the gray areas of care that all the care managers and counselors in our department reside in, and how important they are to Acclaim as an organization providing that holistic care. It really does take a village, and I'm very proud to be part of this one. So Gloria is a client of mine. A little bit about her background. She was a nurse as her career. Then tragically, when her husband was in his 50s, she was married with 2 children. He was on a business trip and passed away suddenly in his sleep. So she had 2 kids to raise. When they were a little bit older, her daughter was on a vacation and there was an accidental death that took place there. So she lost her daughter. And then about 10 years later, her son passed of HIV. So when I met her, she was really and truly alone. So this is a letter I wrote to her after my experience. Excuse me. Dear Gloria, when I met you, after being alerted by your teletouch volunteer that you were in need of more care, who I believe is here today, so hello, you know who you are, hello and thank you. You were living in a cluttered apartment with your cat, you had very little money, you were struggling to care for yourself, and mostly you said you were lonely. Your life story was a sad one. As a person, I wanted it to be more like a spreadsheet where things add up, where good things happen to good people and the bad guys always get caught, where children outlive parents at the very least, where things can make sense to my heart and mind. You had intense pain in your lower tailbone area, but it was unclear why. You didn't want to go back to the hospital because, in your words, you felt like you might never leave. The doctor, or your doctor, was away for a week, so I went out and bought you a comfort cushion to sit on. Yay, Client Assistance Fund. I then called the community care medics, and it turns out you had an infected bed sore. Antibiotics were prescribed, and a wound care nurse was organized. I helped her fix it in the way that I could by shining light on your needs and generally making noise. I visited a few days later to find out that you were still in pain and having severe incontinence issues, which were adding to your discomfort. I brought by a case of water with me to make sure you were hydrated. Yay, Client Assistance Fund again. I called your doctor and the wound care nurse returned. It felt a bit like a game of whack-a-mole where I bashed another one down. You called the next day in tears. You'd reached into your box of Depends to find it empty. I went over and brought a box with me, yes, Client Assistance Fund, to find you sitting with a hand towel between your legs in tears. I'll never forget that. You had wet the bed and the floor. We chatted. It seemed your bladder had been causing issues for quite some time. Perhaps all the damp caused the bed sore. I called the doctor, made an appointment. I felt like the little fixes were adding tiny numbers to the plus column of your spreadsheet, which selfishly helped me to manage my own feelings. But now you needed a lottery win. You always loved the Bronte area and said you'd love to move into the Oscar building down there to make a friend, and you knew you needed assisted living at that point. Okay, I was on it. I got all the information over 2 days, submitted the application into the hands of just the right person. 2 weeks later, we went on a tour with your lovely Acclaim volunteer. Hello again. You loved it. And for the first time in a while, you felt positive, you smiled, giggled, made jokes. Now we wait. Dreams come in all sizes. But waiting doesn't feel productive to me. It feels safe when we're moving in the right direction. So I made some calls to enhance support. Lots of visits were made, baby steps, but at least our toes were pointing forward. Then an email came through from your volunteer. Honestly, volunteers are priceless, and I cannot say that strongly enough. He had tried to get a hold of you over the weekend, but he couldn't. So he went over to your apartment, where he was informed by your superintendent that you had sustained a fall and been taken to the hospital. I went the next day to the ER and found you lucid but in pain. This is where you told me they had found a large mass on your bladder. I went once or twice a week. Your volunteer was visiting frequently. He was your only friend during a very difficult and lonely time. I brought your rent checks to your landlord twice. Your cat needed to be cared for, so I called to have her rehomed. The cost was almost $200. 2 of your credit cards were declined in the hospital. So I paid the fee from, yes, Client Assistance Fund. I had the pleasure of bringing your Christmas gift from one of our lovely community sponsors. Inside it was a soft, fuzzy blanket. I put it over you and you said, "This is my somebody cares about me blanket." And you smiled with your beautiful toothless smile. The generosity of strangers is a beautiful thing. And I wish sometimes they could see the faces of those they impact and enjoy that precious moment when the client realizes that the gift is actually for them. Your volunteer had also been visiting, and we were told you were being transferred to palliative care. I'd planned on going in to see you, but 3 hours later you passed. I still don't really know what happened. You were witty and funny and still had a lot to offer this world. So did I fix everything for you? No, but my efforts still mattered. The one thing I really wanted to do was get you in that Oscar building down in Bronte, so you could make a friend, enjoy a meal beside somebody, play a game, and just kind of see you as the woman I saw in you. For that, I'm sad about. There's a painted rock down in Bronte with your name on it, right there with a view of the building that sits. I did what I could. I took tape and plugged the holes of your life where I could, but at least kept on springing. Every person on the community support services team is a professional hole plugger. Outcomes are unpredictable, and you literally never know until you try, so we all keep on trying. But we also know that even though more leaks are still possible, the water pouring in matters. The additions to life matter in the forms of fostering human dignity and caring and compassion by others. It fills our buckets and readies us for the next challenge, or allows us that metaphorical water to share with others in the form of care. Little fixes mattered as it meant that you knew you did. And that's it. So thank you for the time to share that, and thank you for listening.
Thank you so much, Nicole. I think that's a beautiful example of just how much heart and care it takes to provide extraordinary community care and support people like Gloria, whose story is all too similar to many of the people that we help. So I hope you got the sense from Nicole's story just how much emotion goes into the care we provide. And certainly over the last couple of years, as the pandemic has gone on and we care for more and more people, that emotional toll on our staff has been real. We wanted to do something special and ongoing to support the emotional health of our staff team. So this year, Acclaim Health was one of the first home and community care organizations to implement something called Schwartz Rounds. And we are going to tell you what those are.
Health is implementing Schwartz Rounds because it's really a recognition of the emotional toll that our work has on us. And this is true for all the services that we provide across the organization, and really recognizing that we don't often get a chance to talk about how our work affects us personally and emotionally.
This is an opportunity for each of us to pause for the client, to recognize what's happening with them, but also with ourselves and each other, to pause and appreciate as an organization with my colleagues, to enjoy their skills and their capacities and willingness, and to pause to learn and to grow with each other.
There's a different theme for each round, and we will have panelists who will talk about their experience based on that theme and sort of how that work or how that experience impacted them emotionally. And then there's the opportunity for everybody who is there to participate in the discussion and really, hopefully achieve a couple of things. First of all, recognize that what they're feeling sometimes are feelings that are shared by other people. So that sense of connectedness to other people in the organization, that opportunity to talk about the impact and the emotional toll of your work, and the opportunity also to share strategies and things that help you to maintain that sense of compassion in your work.
Once someone starts the conversation, I think people feel more at ease to talk about their feelings and healthcare in general, and the struggles that we have. And collectively, sometimes there's just the tiniest of voice that can come up with a pretty great solution, or at least have a wonderful shoulder to lean on.
There were no judgment statements. Everything was so open and respectful. And I so valued how our colleagues, we were all so appreciative of each other's work. And it was an intimate space, but a very, very special, safe space.
I found it therapeutic, and I thought it was therapeutic for the keynote speakers as well, to get some, to talk about their experience, first of all, and then, and it just gave me a renewed sense of pride in the work that we do, and just a renewed sense of pride in Acclaim Health.
Hi, everyone. I'm Kelly McWilliams. I'm the Senior Director of Health Services, and it's certainly a pleasure to be here today. COVID, well, it's been, it'll be really nice when COVID doesn't have to be a topic of conversation anymore and a standing agenda item. It's been a really challenging year for COVID at Acclaim. We've seen COVID-related absenteeism for PSW really averaging about 16% and peaking back in January at about 26% of our PSW staff being off. Nursing was hit just about as hard, with an average absenteeism rate of about 17%, and again peaking in January around 23%. Seeing COVID-related absences this high has put an incredible amount of pressure on the frontline staff to ensure the patients continue to receive the care that they so need and deserve. All of this while providing care to hundreds of patients that were either COVID positive or exposed to the virus. There's no doubt that everyone is tired. This entire organization, from the frontline staff to the leadership team, have worked incredibly hard this past year to ensure both our staff and our patients are kept safe and well informed. Over the past year, this amazing team has procured, distributed, and used 7,521 pieces of eye protection, 4,474 bottles of hand sanitizer, 301,616 masks, and a whopping 938,870 gloves. Those are incredible numbers of personal protective equipment that we've been able to distribute and have our staff use to keep them and their patients safe. I can't recognize or thank the Acclaim Health teams enough for pulling together and sticking together in a very grueling year of this pandemic. But as much as the pandemic has impacted our patients and families and the Acclaim Health staff, there's certainly been some positive outcomes. The pandemic has given us the opportunity to think differently about providing care and opening the door to virtual care. Acclaim had the opportunity to partner with Connected Care Halton OHT and 2 other service providers to explore the expansion of virtual nursing visits for both our clinic patients and our stable palliative patients. As the lead agency, participating in this pilot project afforded us the opportunity to put technology in the hands of our patients. We were able to purchase 30 tablets and the remote care software to provide to patients who didn't have the hardware to participate in virtual visits. We were able to offer choice to our patients. For example, rather than having a patient come to the clinic every day, they could have the nurse do an interactive video call with them. It allowed our patients to become more independent with their care. They can be taught how to change their dressing, for example, and feel confident that while performing the dressing change in their home, they have a nurse watching them and coaching them through proper technique. Virtual visits mean that the nurses don't have to travel from home to home, saving some valuable time and adding some capacity to a system that's challenged with recruitment of nurses. And we were also able to have our nurses that were isolated because of COVID continue to see their patients virtually. This project was a great success, surpassing our targets that were set out. In 2021, we performed 1,677 virtual visits, so an average of about 140 virtual visits a month. In the first 3 months of 2022, and aligning with the launch of this virtual visit pilot, we completed 1,535 virtual visits, or an average of 512 per month, almost quadrupling our monthly totals. The patient project survey results provided very positive patient experience with the virtual visits and the hardware that we were able to supply. So despite this COVID pandemic, we've been able to provide care and support to those who need us the most, with a focus on how we can provide that care differently. When the going gets really tough, like it did in the second year of this pandemic, the tough get going, and Acclaim Health really got going. And we'll continue to get going until this pandemic is finally declared over.
Hi, everyone. That ended on a great note, Kelly, when it's finally over. I'm Renita Wood. I'm Director of Adult Day and Caregiver Support. And this past year for Adult Day has been incredible with the completion of our building projects. And we wanted to thank you, the community, for supporting that vision and helping us create the best facilities for Adult Day programs and services. I'm very happy to say that we were able to open up the Adult Day programs last July. And we're now finally working our way towards 75% occupancy. So yes, like Kelly says, we can slowly see ourselves to being fully occupied again. On the slide deck, you see the outside of our Mississauga Club, which is something we were able to build within 3 months last year, and do at the same time as we were still finishing up Patty's Place. So it's a brand new club space, purpose-built for us. Lots of lights, large rooms, you can see lots of windows, secure access, and it enables the Mississauga Club to be in a place where they no longer have to operate in the same space within a larger community. We've also seen a lot of movement of our staff and our clients. We relocated 3 programs last year, our Mississauga site, our Walmley and Soper. And sometimes we did it twice because the site we were moving to wasn't quite ready. So we moved them somewhere else. So lots of movement. And I want to also thank the staff, because the staff were asked to work at different sites at the drop of a hat because of staff absences due to COVID. So, so sometimes the staff, when they came in the day, they didn't know that they would actually be working at another site for the day. So again, just a big thanks to the staff for being so flexible and patience for working together with us. As I should say, we're all very happy to be back. Our staff, our club members, our families. It's so wonderful to see the joy back in the programs. Our caregiver supports continued on both virtually, and we're able to offer all the education programs virtually. And we also hosted some truly amazing caregiver socials and wellness programs. Again, new learning for us. We didn't know we could do so well on those virtual programs. We're now transitioning to a point where we're blending some in-person support groups as well as the virtual support groups, and having an in-person wellness group. In fact, tomorrow we're having an amazing day at RBG tomorrow for our family caregivers. I want to take a moment just to thank everyone. I've had a wonderful career with Acclaim Health. I will be retiring at the end of July, and I just want to thank the staff, club members, and families for sharing their journey with me and allowing me to be part of their lives. And I'm happy to announce that Katie Zielinski, who will be your new director, and she's going to share with you some highlights about Patty's Place with you.
Hi there. Thank you, Renita. I'm Katie Zielinski. I'm the manager of Patty's Place. How amazing is it that Patty's Place has been open for 7 months now? So our Soper Club, our Wamley Club, and our new addition, Jim Sweets, has allowed us to provide a safe and social environment while still providing that much needed respite for our caregivers and families. Jim Sweets overnight respite has been very successful since we opened last November. We were seeing up to 22 new and current members coming to stay for trials on a monthly basis. So on a regular month, we would admit about 5 to 8 new members in the day program. So it really shows how much the service has been needed. And thank you to everyone that has worked so hard and helped so much with making Jim Sweets possible. Another wonderful thing we've been able to introduce this year has been to increase our capacity with music therapy. Music has such a powerful connection to our brains, our emotions, and our overall well-being. And thank you to all the Dine-In for Dementia participants for making that possible. It gives me great pleasure now to introduce Meredith, our music therapist. Thank you.
Hi folks, as Katie said, my name is Meredith and I'm a certified music therapist. I actually did start with Acclaim Health as a volunteer when I was 18, which then led to me being a summer student with community support services, which then led to me completing my music therapy internship with Acclaim Health at the end of my bachelor's degree. And after I finished my master's in music therapy, I got the chance to come work for Acclaim full time, and I'm so happy to be back. As Katie sort of touched on, music is a unique therapeutic medium, which really does light up all the parts of our brain. We talk about the benefits of music therapy affecting the cognitive, communicative, emotional, musical, physical, social, and spiritual domains. Music has the unique ability to connect to our memories and emotions, to motivate and move us, to help us forge connections with others, and to get neurons firing along paths they might not have explored in some time. Music therapy is used with individuals across the lifespan, but for folks with dementia specifically, music therapy can be used to calm anxiety and lift someone's mood, to motivate movement, as a way for individuals to connect with important memories of their life, and as a way for individuals to connect with the people around them, even if they no longer have the ability to communicate verbally. In group and individual sessions, folks will take part in drumming, singing familiar songs, songwriting, improvising with a variety of musical instruments, dancing and moving to music, and reminiscing or discussing their connection to various pieces of music. As mentioned, I work at the Acclaim Health Day programs. I provide each day program with 2 group sessions per week, and I also provide individual sessions based on demand and need, and I work as well with community support services to provide in-home music therapy for folks in the community. I'm also going to get the chance to provide some support to caregivers, both at the Royal Botanical Gardens caregiver event and with a 3-week music therapy group for caregivers in July. In the 5-6 months I've been here, I feel like music therapy has been well integrated into Acclaim Health services. During the group sessions, I get to meet and learn about so many club members in their lives as they share their connections to pieces of music, select instruments to make music with, request songs for the group to sing, or respond with such creative answers to songwriting prompts. Both staff and club members alike are always so ready to jump in and try new things. And I'm sure anyone who's come through Patty's Place will know we can get pretty loud when we all come together. Individual music therapy has been a helpful resource for folks at the day program. We have so many folks who come to the day program who are honestly better musicians than I may ever be. Sometimes for these folks, my role might be adapting an instrument or sheet music to make it more accessible or helping with the setup, and then they're ready to go. Re-engaging with a skill they love and may have been unable to access for a while can often remind an individual of just how valuable and knowledgeable they really are. And though the day programs are an incredibly welcoming environment, sometimes individuals will experience anxiety at the very beginning of the day when they have to leave their caregiver and walk through our doors, maybe not remembering that the day program is a place they've been before and a place that is safe. For a couple individuals, we've been mindful about scheduling music therapy sessions at the very first moment of the day when they first walk through the door. Because our memory of music is often well preserved, using music that is familiar to an individual can help create a sense of safety and familiarity. The fact that I have my guitar and use live music, which I bring right to the door again, It motivates an individual to often sing and join in. And when you sing, it can really regulate and deepen your breathing, leading to a natural slowing down effect that counteracts the physiological effects of anxiety. All this helps to transition individuals into the day program and often has an impact that lasts after music therapy and helps to improve someone's day overall. I'm sure you're all aware by now, I could talk a very long time about my field, but I'll end here for now just by, again, expressing gratitude for all the donors who helped make my role possible. I feel like we've already accomplished so much, and I'm so excited to see what the rest of this year at Acclaim will hold.
Good afternoon, everyone. My name is Patricia Blakely, and I'm the Director of Community Support Services. And before I start, I really just have to say how thrilled we are to have Meredith join us as a full-time music therapist. It has been an incredible pleasure to watch her grow and develop, and just amazing. So thank you, Meredith, for all you've accomplished already. And then my second starting point, I guess, is to start by thanking Nicole for sharing her story about Gloria. I think it truly does highlight the impactful work that happens for our clients who are truly alone. Our staff do incredible things to ensure that clients get the additional supports they need that really add meaning and value to their lives. And so just a shout out to the staff who really find incredible ways to achieve that. The other thing it speaks to is the incredible contributions that our volunteers make every day. They truly are the eyes and ears of our clients, and we count on them to let us know when something changes or their clients need more support, exactly as that volunteer emailed Nicole to let her know what was going on. Volunteers truly give from their heart, and they expect nothing in return. As we said, the last 2 years have been challenging, and I have said this before, how amazingly our volunteers stepped up. They've been creative, flexible, creative, and deeply committed to supporting their clients through very difficult times. So finally, after many ups and downs and lockdowns and closures and reopenings, our volunteers started to do in-person visits, in-home visits once again last August. And oh, the difference that makes. Being able to see each other, being able to go out together for a coffee, just being able to be there has been invaluable to our clients. We've seen so many of them deteriorate as they experience increased isolation and loneliness over the course of the pandemic. And having that volunteer visitor come back just adds so much value and meaning. Each year in April, we celebrate National Volunteer Week. In addition to thanking all of our volunteers, we like to acknowledge and honor those volunteers who are receiving their long service awards. So the pictures that you're seeing here show us as we delivered out appreciation gifts and certificates this year. And this year, of the 29 volunteers who received a service award, we had 6 who had over 20 years of service. So Bev, Lorraine, and Liz each have been with Acclaim Health for 20 years, and Mags, Joan, and one of our volunteers who insists on staying anonymous have 25 years with Acclaim Health. These 6 volunteers together have provided 135 years of volunteering. Just amazing. So thank you. Thank you for your dedication to Acclaim Health, to your clients. You are our inspiration. And to all of our volunteers, thank you for choosing Acclaim Health to share your valuable times and gifts. We want your experience to be positive, and we hope it is fulfilling. And we will do everything we can to help you feel prepared, confident, and supported in your role. Volunteering truly is a work of the heart. Thank you.
Hello, everyone. My name is Lynn Johnston. I am chairman of the board at Acclaim Health, and I want to thank especially those people who have shown up today. It really makes us feel good to see some of the helpers that we have out in the community. And I would like to let you in on some of the things that this organization has achieved during the past year. As a board, it's our priority to ensure that Acclaim Health is a strong, well-managed organization that is rigorous in its pursuit of good governance and fiscal responsibility that champions equity, diversity, and inclusion. To these ends, I'm proud to say that this year we achieved recertification with Imagine Canada Standards Program, strengthened our commitment to employee safety by participating in the WSIB multi-year health and safety excellence program. And we also completed an equity, diversity, and inclusion audit, and the resulting recommendations will be implemented during this coming year. In terms of our financial picture, you can see in front of you now some highlights. The COVID-19 pandemic did have a more serious financial impact than the previous year. However, strong community support and our committed staff team allowed us to come through this with a decent still in decent financial shape. We appreciate the coming year we anticipate, the coming year will allow us to rebuild now that Patty's Place has been completed and the pandemic is hopefully winding down. The full audited financial statements will be emailed to you after this presentation, along with our annual report, so that statements you can pursue figures at your leisure. It's been a transformational year, all in all, for Acclaim Health. We have risen to the challenge of providing exceptional care during a pandemic. We have seen our dreams realized in Patty's Place. I am incredibly grateful to our community's support. It's only together that we have been able to do so much for so many. Thank you all very much. I would like now to introduce our fearless leader again, Angela Brewer. I can't ever find enough adjectives to introduce her, so I'll just let her take the floor now.
Thank you, Lynn. That was a great look at our year path. I'm going to look ahead a little bit now. I think it won't be a surprise to anybody to hear that one of the things we'll be focusing on this coming year is just rebuilding and stabilizing. COVID has taken its toll on Acclaim Health. I think healthcare was probably one of the hardest hit sectors during the pandemic. I'm speaking as though it's in the past, but that's likely not the case. But I'm trying to be a little bit optimistic here. As a home and community care provider, we've encountered the same issues as the rest of healthcare: burnout, exhaustion, staffing shortages. And now it's going to take us some time to build back, and we need to do so thoughtful and carefully, always keeping in mind that our organization is our staff and our volunteers. They are the heart that keeps Acclaim Health alive. Supporting staff while we rebuild is going to be vital. And to that end, we've added a fourth strategy to our strategic plan, which focuses specifically on that. As you've heard, Patty's Place is up and running with the help of our entire community. And as Renita said, we're moving towards 75% occupancy right now, with the goal, of course, of reaching 100%. This amazing dementia care center opened during the pandemic and has never operated otherwise. So we're really watching it closely to see what the impacts of 100% occupancy look like on the physical environment, financially, and staffing wise. So we can see what that looks like for next year and years after that, and the impact that will have on our fundraising. Another thing that we're continuing to work on is wage parity. This is something I'm extremely passionate about, and I've spent quite a lot of time over the last year working with our provincial association, Home Care Ontario, advocating for wage parity for our staff with hospitals and long-term care. I firmly believe that home and community care is a hugely important part of our healthcare system. It's where people want to be, and the roles across the system are very similar. Home care, in fact, could be said to be a bit more challenging for staff as they work very autonomously. So they're out there driving from patient to patient, There's no one to bounce ideas off, like that's right beside them, no one to ask for help. So it really is, they really need to be experts at the care they provide to provide good care. We've had some great wins over the last year with the government's nursing retention bonus being applied to home care, as well as the PSW permanent wage enhancement also being applied to home and community care. But these have not really filled the wage parity gap. And I mean, my dream is to one day see a healthcare system where people can choose where they work based on their interests and their passions, rather than on wages offered. I believe this would benefit all patients, regardless of where their care is being delivered. It is counterintuitive to think that home, where people want to be, is the setting that is least enticing to work in. So this is something that we will continue to focus on this coming year. The pandemic brought some expected staffing challenges in terms of people being in isolation or in quarantine, but I don't think anyone saw the deep impact it would have on the stability of staffing in home care. We did see some, particularly nurses and PSWs, move to other parts of the healthcare system or just out of healthcare altogether, either through early retirement, burnout, moving to jobs, doing things like vaccinations that were paying higher. It really shone a spotlight on a major crack in healthcare, and specifically in home care, which is health human resources. People can't go home from the hospital if there isn't home care to go home to. People can't stay home out of long-term care if there isn't home care to stay home with. And so we're seeing increasing vacancy rates across the province and the country. And we as Acclaim Health will need to become more creative and resourceful to attract and keep our staff. But right now it is an uphill battle, and we are advocating really hard through our provincial associations to make sure that the government is aware of this. I think we've made some great inroads there. We've also had volunteers leave the sector. Some are slowly coming back, as Patricia said. However, some of them either can't return or haven't returned. They themselves may have become more frail as they stayed home, which I think happened to a lot of people, certainly people that I know. 2 years is a long time to not have a lot of social contact and to not have a lot of physical exercise, getting out and things like that. And so we are in a major recruitment effort to meet our wait list for programs like friendly visiting, hospice visiting, and telephone reassurance. All really amazing programs, all in very high demand and all reliant on volunteers. And I think the last thing to really look at in the year coming is the changing healthcare landscape. So with the Ford government, over the last 4 years, they have implemented Ontario Health Teams, which are sort of smaller geographic teams that will bring acute care, long-term care, home care all together to provide a more patient-friendly, easier to navigate, and a place where healthcare staff from all organizations can work together to wrap care around a patient. Acclaim Health is partnered in 3 of these Ontario Health Teams: Connected Care Halton, Burlington, and Mississauga. And in addition to all of our other work, we're involved in 16 communities and 4 large projects across these OHTs, including leading a project for virtual nursing care, which Kelly talked a little bit about. And the government is currently working on a plan to bring home care into the OHTs without causing disruption to patient care. And we are sitting at that provincial table, which is called the Home Care Modernization Table. So that's something to look forward to as well. Just in closing, it's been nothing short of a brutal second year of the pandemic, but I am looking forward to implementing some of the good things that have come out of this adventure, leveraging some of the things we talked about, some of the technology, to implement our hybrid working models, which I think everyone has come to know and love over the last 2 years, to continue with the virtual nursing care that we've put in place, to add our virtual day programming, to keep in place things to support people like Schwartz Rounds, and our employee assistance program. But I think the thing I'm probably looking most forward to is some return to normalcy and to see people in person. I've seen enough two-dimensional people over the last 2 years to last me the rest of my life. So I'm looking forward to taking down the masks and seeing what's behind there, but really seeing our team in person again is something that I'm really, really excited for.
Thank you, Angela. And I would just like to say that Angela rarely toots her own horn, so I'm going to do it for her. It has just been announced that Angela is the incoming president for the Home Care Ontario Provincial Association that advocates for the home care sector. So we're very proud of you for that, Angela. And also late breaking news, and we just heard that Angela is going to be honored with the Queen's Platinum Jubilee Award for her exceptional service to this community over the course of her career. So congratulations to you, Angela. I didn't tell you I was going to announce that because I knew you wouldn't want me to, but I did it anyway, and you can't stop me now. So there you go. It's very much well-deserved. So now on to me. What's next? As Angela said, the healthcare system is in flux, and it has been a couple of epic years. We've had the pandemic, we've built Patty's Place, and Acclaim Health doesn't stop there because we are always evolving to meet the needs of this community. And that is something that everybody benefits from. And it's something that it takes all of us to do together. So I'm here to announce a couple of exciting things. We will be hosting Dine-In this year in September. Dine-In is our event, and we deliver meals from Trattoria Timone. And last year it has been Dine-In for Dementia for many years as we work to build Patty's Place. This year it will be Dine-In because you care, and we will be featuring all of the wonderful things and programs and supports that Acclaim Health offers in this community. So that will be very exciting. Also exciting, it is going to have a very low ticket price. Thank you to some wonderfully generous donors and to some sponsors. So this is really Acclaim Health's thank you to you, our community. We are very, very grateful for all of your support and know that all of the wonderful things we talked about today wouldn't be possible without you. I'm also really excited to announce Because You Care Major Gift campaign. So as we work sort of through the post-pandemic period to rebuild and to continue to evolve, to support Patty's Place and do all the wonderful things, we are going to be entering into a major gift campaign to raise $600,000, and all major gifts will be matched due to the wonderful June and Ian by 50% with a 3-year commitment. So that's very exciting news as well. Again, very grateful for this community support, and more details will be coming shortly. And lastly, but not leastly, that's not even a word, we want to say thank you to you, our community. You have truly inspired us to create compassionate care, extraordinary community care. And on behalf of our clients, people like Gloria, whose stories you heard at the beginning of this presentation, on behalf of our staff team, we have truly felt your support this whole year. You are absolutely incredible, and you are truly the heart of community care. So thank you so, so much to you for that. And now we come to the question and answer section of our presentation. So if you do have a question for us, I know we have had some questions submitted already. If you do have a question for us, you can submit it into the chat, and the wonderful Laura Pizzacala will say your question and we will get you some answers. So I know, Laura, we have one to start us off.
Yes, we did. Thanks, Melissa. So Patricia, we had a question if our meditation sessions would continue throughout the summer.
Yes, and yes, they certainly will be. They've been very popular. They continue to be popular, so they'll be continuing right through the summer.
Amazing. I don't see anything in the chat right now, but if you have a question, please do pop it in there and we can address it.
And while we're waiting to see if anybody has a question, we will be emailing out our annual report and our financial statements and a recording of this presentation in case you'd like to live through it a second time. You're in need of some entertainment. Netflix, you've run out of Netflix? I don't know. We will be emailing that out tomorrow morning. Any other questions, Laura?
And someone's asking about sharing the recording with someone who couldn't attend. Absolutely. Please share this. Feel free to share it with anyone who's interested. We'd love that.
If you got the link for today, you will get the email with the presentation and all of the assorted documents. Okay. And so, is that it, Laura?
That's it.
Okay. Well, thank you so much for joining us. Thank you once again for your support. Thank you to Angela and all of our amazing presenters. We do truly have an awesome team here at Acclaim Health, and I hope you get the sense of that through this presentation. Volunteers, amazing volunteers, and amazing supporters. And that's because we have an amazing community. So I hope you all have a wonderful night, and we will see you soon.